I just want to quickly note that there are a couple of handouts attached. You should see it on the right-hand side of your webinar. These are FAQs to address some of the major questions that we hear regarding the expulsion bill. So those are for providers and anyone else really, just to give you guys an idea of some of the main questions that we hear and hopefully answer some of your bigger questions. So I'm going to just quickly give you guys an idea of the agenda for this webinar today. First, we'll go over just a little bit of background to give you guys some context. You know, why are we addressing early childhood expulsion? Why is this important? And what are other ways it's being addressed outside of just this this policy? And then we'll go into Public Act 100-105, which was a House Bill 2663 while it was just a bill in the legislature, and then it became Public Act when it was signed into law. This is Illinois' early childhood expulsion policy. We're going to go through just a little background on our process to get that bill passed, and then also the key components of that bill. And Allie will talk to us a little bit about best practices in preventing expulsions, and as well as some resources to support implementation of those best practices and of the policy in general. We'll go over some next steps, you know, what state agencies need to do for implementation and where they are now and what we will see in the near future. And then we'll go into we'll have some time for some questions and answers. And first, we'll answer questions that we received ahead of time. We got a lot of great questions from people who are planning on attending. And we'll answer those, and then we'll move on to questions that we get throughout the webinar. So if you have questions at any time, please put those questions into the questions box on the right-hand side, and we'll make sure we get to those. And if we don't have time to get to all the questions, we will compile them and send out the answers, the questions and the answers to all those who registered. So if we don't get to your question today, we will answer it for you. So with that, I think I will turn it over to Jonathan to get started.
Thanks, Maria. Hey, everyone. Again, this is Jonathan Doster from the OUNS. As Maria mentioned, I'm here to offer some context for why we moved House Bill 2663 through the General Assembly in 2017. There has been increasing attention paid to the issue of early child expulsions over the past few years, both in Washington and here in Illinois. At the federal level, Early Head Start and Head Start codified improved expulsion policies through the updating of their program's performance standards. In 2014, the federal government released guidance for states and providers on expulsion and suspension policies in early childhood programs, and that guidance included two recommendations. The first is to eliminate or severely limit expulsion, and the second is to support families in obtaining needed services and alternative placement when absolutely necessary. Also, as part of the reauthorization of the Child Care Development Block Grant, the federal government was and continues to encourage states to create a policy on expulsion in child care programs. In 2015, here in Illinois, the legislature improved its expulsion and suspension practices in K through 12 through Public Act 99-456, otherwise known as Senate Bill 100. As I said, that passed in 2015 and it's in its implementation phase now. As you can tell from that list of policy improvements, there's been a lot of momentum in this front over the last number of years, and because we believed as the early childhood advocacy community here in Illinois that the state should be responsible for prohibiting expulsion, we thought the time was ripe for some legislative action. All of these policies are moving forward both nationally and here in Illinois because, you know, while it may seem counterintuitive, research suggests strongly that the expulsion of toddlers and preschoolers from early childhood settings is occurring at alarmingly high rates. A nationwide study conducted in 2005 by Dr. Walter Gilliam, one of the preeminent researchers on this topic, indicated that preschoolers here in Illinois were expelled at a rate 3 times that of their older peers in the K through 12 system. He also found that Illinois reported the 6th lowest expulsion rate among states, though the rate itself is still troublingly high. And I might, yeah, there we go. Kick the next slide over. More recent data from the Office of Civil Rights show that boys, specifically African American and Latino boys, are overrepresented in disciplinary practices that remove them from their educational settings. And increasingly, this overrepresentation is being seen among African American girls as well. School expulsion practices are associated with negative educational health and developmental outcomes for all children. And we know that expulsion in the earliest years leads to higher expulsion and suspension rates in later grades. There are many reasons why preschool expulsion rates are high, and I think it's important to recognize that there's no one thing or one person to blame. It's this perfect storm of a child's behavior, a family situation, the program's interpretation of and response to that behavior, and the state's provision of guidance and resources. So it's this, perfect storm that creates this problem, and we're hoping that we've addressed, at least at the beginning, with our state policy. You can click over to the next slide. This brings us to Public Act 100-105, which, as Maria mentioned, is the law that was once House Bill 2663. I want to talk for a minute about our process for passing, for both writing and then passing the bill through the legislature. When our group of early child advocates decided to tackle the early child expulsion problem here in Illinois, it became pretty clear to us that a statewide policy was important to establish, in part because we wanted to ensure similar protections for children in a range of early learning programs, not just programs funded by one department or the next. So back in the winter of 2016, we sat down and wrote some draft legislative language based on best practices in the field. A lot of it is based on the Head Start performance standards. Once the language was written and we filed a bill, this was in early spring session of 2016, we then had a tangible idea that we were able to share with others. So over the next 18 months, we met and workshopped the language with parents, early childhood providers, legislative staff, the state agencies impacted by the legislation, K-12 experts, leaders in various justice organizations, among many others. Some of the folks are listed there on the slide. We also presented at numerous conferences and meetings, many of which are in front of you as well. We tried to talk about it as often as we possibly could. When concerns were raised by K-12 or the provider community or folks at the state agencies, we made changes to the legislative language. And through this process, we feel like the bill improved pretty dramatically before it was even ever called for a committee hearing. And we also accumulated a long list of organizational supporters along the way. And I think because the groundwork was laid over many months, the lawmakers we approached to champion the bill in Springfield agreed to join our effort without much reservation at all. In other words, by diffusing some of the organizational opposition and by collaborating to obtain input along the way, particularly among ISB, DCFS, and DHS, we helped secure strong legislative support from both parties from the very beginning. So between January of 2017 and this summer, House Bill 2663 accrued 65 co-sponsors. We had 95 votes in the House, near unanimous support in the Senate, and on August 14th, we got a signature from the governor and our bill became law. You can jump to the next slide. As I said, from the very beginning, both us advocates and lawmakers recognize that, of course, not every early childhood setting is right for every young child. The law itself protects children from improper removal while improving transition processes for those who may benefit from placement in a different setting. So I wanted to lay out just a few of our goals when we first introduced and passed the bill. The law provides protections for children in Illinois State Board of Education funded early childhood programs and licensed child care settings against preventable expulsion, similar to those in K-12 settings. It identifies trainings and topics needed to address the problem, and it asks state agencies to make this information available to programs. And lastly, it strengthens data collection and dissemination by agencies funding early childhood services to help inform the agencies, lawmakers, us advocates, and it also will hopefully guide some policymaking and practice planning moving forward. We can go to the next slide too. According to the law, the following early childhood programs may not expel children aged 0 to 5 due to childhood behavior. These are the Preschool for All program, as well as those funded by the Prevention Initiative program and our licensed child care centers and homes serving children birth to 5. This is policy for early Head Start and Head Start, and so we wanted to make it consistent across both state and federally funded programs. The law also creates what's called a planned transition, which means that if there is documented evidence that all available interventions and supports recommended by a qualified professional have been exhausted and the program determines in its professional judgment that transitioning a child to another program is necessary for the well-being of that child or his or her peers with parental or legal guardian permission, both the current and future programs should create a transition plan designed to ensure some continuity of services and the comprehensive development of the child. We wanted to make sure that a child is receiving services in an appropriate setting. We want to set this standard across the board saying that you can't kick a kid out willy-nilly, but we also want to set forth a process whereby family and the provider are communicating and working together to try to find that proper setting. Nothing in our new law precludes a parent or parent's guardian, or a child's guardian, the right to voluntarily withdraw his or her child from an early childhood program. In addition, in the case of a serious safety threat to that child or others, a temporary removal of a child from attendance in group settings may be used, with the clarification that the child must be returned to group setting as quickly as safety will allow. I do want to note that there are a few steps along the way that providers and parents should be engaging in before we ever get to a planned transition. Some of the key components of the bill, the law states that when persistent and serious challenging behaviors emerge, the program shall document steps taken to ensure that a child can participate safely in the program. Those steps include observations of initial and ongoing challenging behaviors, strategies for remediation and intervention plans to address the behaviors, and communication with the parent or legal guardian. The early childhood program, shall also utilize a range of community resources if those resources are available and deemed necessary, including but not limited to developmental screenings, early intervention, consultation with infant, early child, and mental health consultants, healthcare providers, those sorts of resources. The program shall document the attempts to engage these resources. That's part of the law. So even if they're not available, just to make sure that we document all the attempts that are being made. The last thing that I'm going to note about the bill is that there are a few data reporting requirements outlawed. We wanted to make sure that we were tracking progress. It's possible that over time we'll realize that the state's doing quite well in this area, but right now we don't have any data reporting on expulsions or planned transitions, and so we want to do some educating on our own end to make sure that we have the best policies in place. So back over to the last key component slide. We just again want to reiterate what the intent of Public Act 100-105 is and what it isn't. Allie's going to get to what the resources are and what some of the best practices are in a second. But again, the House Bill 2663, which is now our Public Act 100-105, the intent is to make removal of a child for behavioral issues a last resort. It's to make providers aware of some of these resources that Allie's going to talk about and to increase their connections to some of the interventions and supports that are available. And it's the intent is for providers to help families plan these sorts of transitions if the current situation isn't working. The intent of the bill is not to make children stay in a setting no matter what. It's not to make all resources available everywhere, to make state agencies create all new sorts of additional resources. And we're not saying that a current provider, their final job is to have to go find placement for their kid. But hopefully that lays out what the law says and how we got the law to be passed in the first place. But I think at this point, I'm just going to kick it over to Allie, and she can dive into some of the best practices.
Thanks, Jonathan. So we talked a little bit about kind of our reasoning for bringing this legislation to pass. And there are lots of reasons for the high rates of expulsion in early childhood. As Jonathan stated, it's happening 3 times higher in early childhood than in K through 12. And there are also lots of reasons for why there are disproportionate numbers within that, why it's impacting boys of color more highly than other children. And so some of those reasons are things like early childhood education can be implemented really differently. Attendance is an informal process. Also, there are a few formal definitions of suspension and expulsion, and certain program characteristics can contribute to expulsion, which I'll talk about later. There's also a lack of support of the workforce, so there's a need for training and professional development, a need for reflective supervision, and especially supportive practices for teachers, which I'll talk about too. We know, too, that interpreting a kid's behavior is really subjective. Challenging behavior is pretty much a normal part of child development. It's going to happen to every child at some stage. And so acknowledging that there's a lot of knowledge that we need as adults in how to interpret that child's behavior. And part of the tricky parts of this is that things like trauma can really manifest as different things in challenging behavior. And then there are those kids who will require the additional services, the kids who are kind of those high-need kids with severe mental health issues or developmental disabilities that will need additional supports and services. Another part of that interpreting children's behavior as subjective is the whole implicit bias piece. And this is a tricky conversation that not a lot of people like to have, but I feel like it's the important one that we really do need to mention, because when you look at the numbers of expulsion and the disproportionate percentages, we have to know that implicit bias does play a role in our decisions as adults. And what I stress about this is that implicit bias is unconscious. It can be good things. It can also be bad things. So it's not just interpreting children's behavior badly, but also what are we associating positively with some kids versus others. It happens in everyone. We also know that implicit bias it does not reflect who we are necessarily as a person. It's just an unconscious thought that we have and action that we take sometimes. We also know that implicit bias is triggered in times of more stress, and so we rely on our implicit biases when we're stressed out. And we know that teachers have a really stressful job, and if you're attending to a big classroom of high-needs kids, you know, we get really stressed out, and so we might fall back on our implicit biases. Some other causes of the high numbers of expulsion are things like inefficient family engagement approaches, and then a lack of resources. So as Jonathan stated earlier, we don't consider one thing to blame for this issue. It really is the perfect storm of that child's behavior, the family situation, the program's response, and then that macro level of the state's responsibility. So how is the state addressing the issue and providing the resources and the support for the kids and the programs within this issue? So looking at best practices, one of the first things that we can do as a group is to improve the overall quality of programs. And so that involves things like qualified and appropriately compensated personnel, small group sizes and high adult-child ratios, a language-rich environment, developmentally appropriate curriculum, and a safe physical setting, warm, responsive adult-child interactions, and then specifically addressing implicit bias. So I mentioned earlier that certain program characteristics predict higher expulsion rates, and so things like teacher-child ratios and longer length of program day. Also, teacher job stress and depression has been linked to higher rates of expulsion, and so that's why we recommend, you know, these supportive practices and policies for teachers and the staff, which I'll get a little bit more into later. Another best practice is to implement a tiered system of supports. And there are varying definitions of what those are, but generally they're divided into 3 levels, so the universal, the intervention, and the treatment level. And things like positive behavioral intervention supports are, sorry, let me find my slide, there we go, is one example. Another example is the pyramid model. And so the first tier would be to focus on something like a general SEL curriculum, social emotional learning curriculum. And while initially more time-consuming, these school-wide social-emotional support programs actually offer more benefits in the long term. But again, I highlight that you do need to specifically address implicit bias. It's not enough to just improve overall quality or to implement an SEL curriculum. You really need to get a little deeper into the issue about addressing implicit bias, because a lot of these curricula were invented or created a long time ago, before when cultural competence either wasn't being discussed or wasn't a thing yet. And even within cultural competency, these SEL curricula don't address challenging behaviors, and in particular, they don't address the disproportionate numbers within challenging behavior and school discipline. Next slide. And so I've talked a lot about training, support, and professional development of staff. And we know that underprepared teachers are more likely to use harsh and punitive disciplinary practices. And so there's a lot of training that needs to happen with the staff, and that can be anything as small as just general child development to getting into more specific issues like promoting social emotional development and specifically addressing challenging behaviors, trauma, cultural humility, reflective practice. Even knowledge of expulsion and suspension is really important to know. So for all of you who are attending today, just even knowing that the rates are higher in preschool and early childhood is really important so that you know it's a thing. We also want to recommend training on recognizing and addressing implicit bias and microaggressions, family engagement, and especially knowledge of resources and referrals within the community. Training is really important for not only that direct service staff, but also supervisory staff as well. So supervisors and program directors might need to know all of those topics I just listed, but some additional topics might be things like how to provide reflective supervision to your staff, how to support your staff, how to have difficult conversations. And so when we talk about the family engagement piece, how to talk to families either about a child's concerning behavior, but also how to talk to all the other families within your program who are concerned about one quote-unquote problem child and not identifying them as a problem child. Training is really important both pre-service, so before you go into the field, but also ongoing. We know that it takes multiple times of hearing things before it finally sinks in, and also being able to do it within practice is really important. And so things like coaching and consultation that are embedded and ongoing within your program are really important, and I'll talk a little bit more about consultation in a second. And then again, I've talked about supportive practices and policies, so things like adequate break time for staff. Does your staff get a chance to kind of take their own little time out if it's been a long, stressful day? Compensation is also a big issue, and when I say compensation, I don't mean that all of you individual programs should really focus on spending more money on your staff. I mean, you should, but I also mean that it's the responsibility of the state as well, and so the advocate community is really always trying to advocate for higher compensation for our teachers, because we ask you to do a lot of things. We ask you to know a lot and be very well educated and trained and take care of our most precious things, and we don't pay you enough to do that. And so while compensation is a much heavier lift, it's still an issue that we are concerned about advocating for. Another best practice is the use of infant and early childhood mental health consultation. And so research has shown that teachers with access to a mental health consultant are half as likely to report expelling a child. And a lot of this research comes out of Walter Gilliam and all the work that he's done on the issue. We know that it decreases teacher-rated acting out behavior problems, and it also may be related to lower staff turnover, improved teacher effectiveness, and higher program quality. We want to be clear that mental health consultation is a support for the staff. Mental health consultants don't actually provide the actual services for the kids and families. They may be able to provide some short-term consultation and crisis intervention to a family, but really when we think of consultation, it's as a support for the staff and being able to use that reflective time with your mental health consultant. In Illinois, there are lots of resources for consultation that I'll talk about later, and I know some of the questions have been around, well, I do have a mental health consultant, but there's a long wait list, and we'll kind of talk a little bit more later about what to do in those instances and how to document that. Next slide. We've talked a little bit about a family engagement piece. Walter Gilliam, who has done so much research, also found that when he would survey programs, he didn't find expulsions in programs where the family and the teacher were actually communicating and getting along. And we know that that's not always true. You can't always, reach every single family or engage with every family. But if you're able to, and you're able to talk to that family about the child's behavior and get a sense of what's going on at home, it's more likely that you'll be able to better serve the child in the classroom, but also kind of understand where that behavior is coming from. And so recognizing that the parents are the child's first teacher and truly partnering with a family, and that they should be included at all points of the decision-making process. I often say with the family engagement piece and even with the mental health consultant piece, ideally, that crisis level, when that child is hitting that breaking point and you're at the point where you're wanting to, have a child leave a program, that should not be the first time that you're talking to that family. And the same thing with the mental health consultant. If it hits crisis level, it shouldn't be the first time that you're utilizing your consultant. Hopefully you're able to use them in a more preventive level before it gets down to that crisis level. But when we talk about family engagement, it's really about partnering with the family and not just offering one-sided opportunities for them to participate, but really engaging in creative ways to engage with them. So things like home visits, frequent conferences, documenting or talking about their strengths and what they do well, involving families in school transitions and decision-making opportunities and leadership opportunities. Another best practice is developmental screening, and so that's another piece of the legislation too that's recommended about utilizing resources. And so if you want to take a really universal approach, you would want to do a preventative approach. You'd want to do universal screening for all the children in your program, again, not just when it hits that crisis level or there's a behavior concern. Because when done well, these can really serve as an effective family engagement tool, because if you're doing it on all the children and then having conversations with the family, that really opens it up to documenting the child's strengths, areas that they're doing well, but also areas that they might be struggling in or places where you or the parent might be concerned. But again, it's one thing to do the developmental screening. I often hear programs say that, well, I can do a developmental screening, but I don't know how to talk to the family about a concern. And so training and professional development and support are still needed to be able to do this. We also hear some programs say that they either can't do developmental screening or don't have the time, but just knowing where to send a family to get developmental screening, that's very important. And so your early intervention, CFC, or your local school district, or even your child's pediatrician could do a developmental screening. But even if you're able to do the screening or not able to, it's also really important for providers to kind of serve as those other voices in the whole entire process. Navigating early intervention and special education can be really hard for families, and so the participation of providers can really help out because you can kind of serve as that other voice. We know that kids act differently in different settings. They might behave one way at home, a different way at school, and so your voice can really add to the conversation and perhaps get a child eligible for services. And then the providers can often serve as that link between providers of therapies like speech therapy or developmental therapy and the family. Oftentimes with early intervention, the services can be provided in the actual child care setting, which can be helpful. And then you can also incorporate any goals from the IEP or the IFSP into your own programming. Next slide. And so another thing that would be a best practice is establishing guidelines, definitions, and policies. And as I've mentioned before, there are a few formal definitions of expulsion and suspension, and it's really important that you as a program develop preventive guidance and discipline practices and make sure that you're communicating all of these to your families and your staff. You want to be conscious of the type of language that's used, so you don't want to use language that's associated with the criminal justice system, so things like probation plans or 3 strikes and you're out, which can create a lot of defensive emotions with a lot of people. You want to make sure that your policies follow state and federal statutes like IDEA, and so referrals to Part C and Part B. And then I also say it's a good idea to get the input of parents and staff when developing your policies, because this helps you get multiple perspectives, but it also helps with buy-in and compliance later on. If families and staff feel like they are able to provide input on the development of these policies, the way that you write something and read something might be interpreted very differently than the way someone else does, and so it's really important to hear how someone else might read what you're trying to communicate. And then later on, it helps when you clearly communicate all of your policies, then everyone's on the same page and has an understanding of what your guidance and discipline policy is. Documentation is another best practice, and so again, we always want to start with from a strengths-based way, it's not about documenting problems, but really starting from the beginning and noting all the good things that a child and a family have and are doing well. And so that way when something changes, if the behavior changes, then you can notice it. You want to observe the behavior from the beginning and document any triggers or patterns or changes. And then as Jonathan was talking about the legislation, it really does ask that programs document any interventions. So instead of just hitting that crisis level and trying to expel a child, you have to now document what types of interventions you've tried. Did it work? Did it not try? Did you try something else? And the results of those. And then at the end of the day, if it is decided with family input that it's the best decision to transition a child out of the program, then you would create a transition plan. And so the communication with the family is really a big piece of this and a big piece of the legislation, because we want to make sure that the families are involved in all parts of the decision-making process and all parts of any intervention plans, and so documenting that communication. As I said before, the parents have the right to refuse services, the parents have the right to disenroll their child, and they can refuse any communication as well. And so when we say document all communication with the family, we also say that includes attempts to communicate with the family, and so documenting any refusals that the family has made. Next slide. Another best practice is knowledge of your community resources and referrals, and so it's really about accessing those resources and referrals that are available within your community. And again, we're stressing that it's what's available and within the scope of your program. And so the legislation does outline things that you should utilize, but it's not limited to those resources. And then also just acknowledging that in some areas those resources are limited, and so documenting all attempts to use those resources. But as a best practice, it's really important for you to get to know your community and knowing and assessing the family's needs and building relationships with those community partners. And so, for instance, if you have a lot of families who are experiencing homelessness, do you know how many homeless shelters are in your area? And could you reach out to them and ask, how many beds are available at any given time? Do you accept families? If I have a lot of families who are homeless, can I refer them to you? If you have a lot of families who have kids, can you refer them to me? And so the same goes with things like substance abuse programs, domestic violence, mental health services, child care assistance programs, food pantries, public aid, and then also knowing your mental health consultant. And when I talk about the mental health consultant, I get a lot of questions from providers who again say that they don't know, or they either don't know that they have access to a mental health consultant, or if they do, there may be a long wait time because there's only one for a large area. And so what we're asking right now too is that you document all of this as well, because the advocate organizations like the OUNCE and Illinois Action for Children are advocating for additional resources. This legislation doesn't put in the additional resources just yet, but if we can also document and show the need for additional resources, then we can further advocate for more mental health consultants or more trainings or more resources for the kids and families. And so that's the last best practice is the data collection piece, as I've talked about. So there's a statewide data collection, but as a program, you can also kind of proactively document a lot of data that can help you analyze your practices within your program, but that could also serve to inform the larger system as a whole. And so you'd want to collect your current data and review it and look for any disproportionalities. So disaggregate it by age, disaggregate it by race, gender, ethnicity, special needs, or language ability. And then you could take a look at it and consider any changes that you may need to make, or investigate some of the reasons for why some of your data is showing what it's showing. You also want to operationalize and be specific, and so you want to make sure that you are operationalizing your behavior descriptions. So what do you consider challenging behavior? Is it things like cursing or inappropriate language, or is it all the way down the spectrum to kicking, hitting, biting? What do you consider challenging behavior? And some examples of some of the things that you could collect are the number of behavior incident reports, the number of temporary removals from the classroom, the number of transitions, the number of kids leaving and the reasons why. One of the particularities to early childhood expulsion is that if you outlaw it and say that you can't expel, then that number is always going to be 0. However, within early childhood, there are lots of reasons why a child could leave a program, and it comes around to what we call soft expulsion. So things like convincing a family to leave, saying something like, oh, maybe Johnny's just not a great fit for this program, and then the parent decides to leave. Or if a parent is being called every single day to pick their child up, they might get frustrated. It would be hard for them to continue working, and so maybe they then pull their child out. And so really not just counting the number 0 expulsions, but just any reason that a child is leaving the program and how many, so that you can maybe take a look at your own data and see what's happening there. You'd also maybe want to collect information on the number and types of exclusionary discipline practices, so timeouts, or if the child has to be removed from the classroom. Again, usage of your mental health consultant, so how many teachers have access to it, how many times they use them a month or a week, how many hours you called them. Again, numbers of developmental screening, how many kids were screened, what were some of the issues, how many scored concerns, and then referrals. And that can be referrals out to any type of service, whether that be for the child or the family. Next slide. And so we wanted to make sure that you all had some lists of resources of things that will support this implementation. The Transforming School Discipline Collaborative, really, they formed around SB 100, but have now included early childhood advocates in their collaborative. So this collaborative is made up of a lot of restorative justice experts, a lot of legal advocates who represent special needs cases, and school administrators, and they have a lot of resources on their website that currently are focused more on K through 12, but with the passage of House Bill 2663, we're going to be adding a lot more early childhood content to that. ISB also has a lot of specific topics around anything from challenging behavior to cultural competence to social emotional learning. Town Square is an online portal for child care providers that is also linked to the Gateways credentialing system. You can take some modules that will give you some credit in Gateways. The child care resource and referral agencies offer infant toddler specialists and mental health consultants across the state to child care providers. And then specifically outside of Cook County, Caregiver Connections is the organization that offers the mental health consultants to child care providers. Within Cook County, it's the CCR&R for Action for Children. The Illinois Association for Infant Mental Health has a master's level credential around infant mental health that anyone with a master's can participate in and get credentialed as an infant mental health endorsement. They are also working on a bachelor's level credential that will be unveiled in a few years at some point. But to just join the Infant Mental Health Association and get on their listserv, that's completely free. And to join, I believe it's $40, but they have a lot of resources around infant mental health. The Illinois Children's Mental Health Partnership provides infant mental health consultants to our McVie home visiting programs, and they also have a lot of resources on their website. The Childhood Trauma Coalition has a geomap that you can click on that will offer a list of organizations that provide trauma services in various parts of the state. Crossroads Anti-Racism Organizing and Training is an organization here in Illinois that will help a program address implicit bias and anti-racism issues, and they do a lot of trainings. Accelerate Illinois has the Child Developmental Screening Guides and Tools. And then we have various professional development organizations like the Center of Professional Development, the Illinois StarNet, Early Choices, and the Erickson Institute, which offer coaching and workshops and training opportunities and consultation for programs.
All right, so from there, I think I'm going to take over and we're going to talk about some next steps for implementation. DCFS and ISB, in collaboration with the Governor's Office of Early Childhood Development and the Department of Human Services, they'll work together to adopt the rules, the administrative rules that will specify the details for implementation and monitoring requirements for both licensed child care programs and those early childhood programs receiving ISB funds. This will happen, at least in terms of the DCFS portion, this will happen through the JCAR process, which is the Joint Committee on Administrative Rules. And that is a body that's made up of 12 legislators. And so the process, this graphic here kind of outlines it, but you'll see that DCFS puts out proposed rules. And again, those rules will amend the licensing standards, which are section 406, 407, and 408. And they'll put out the proposed rules, which they're drafting right now, and then it goes to what's called the first notice period. And during this period, that's when DCFS will accept public comments. As an organization, Illinois Action for Children will comment on those, and then also any individual, any provider, you as a public citizen, you can submit comments as well, and we will let you know when they're up for comments. So you submit those comments, and DCFS has to review all of them. They can make changes to the proposed rules during this time, and then it goes to the JCAR hearing. So that's when it goes to those 12 legislators who are part of JCAR, and it's heard in a normal hearing, and then they can either object to certain pieces of it or approve it, and then at that point DCFS adopts those rules. So like I said, DCFS is currently drafting those proposed rules right now, and as soon as they are released, we will let everyone know, and that's when they're up for public comment. And ISB has a different rulemaking process. Instead of going through JCAR, they go through the State Board of Education. So when ISB rules are posted it's called the initial review period instead of the first notice period, initial review, that's when ISB will accept the public comments, and they'll review them all, and they can make changes to proposed rule language based on public comments. And then those rules for adoption are posted by ISB, and then they go to the state board for a board vote, and then they're adopted by the department. So like I said, they will be doing these kind of in collaboration, DCFS and ISB, along with OECD and IDHS. And so, like I said, that will include implementation details and monitoring requirements, as well as the data collection piece. They're working to develop that right now, the data reporting and collection process, what that will look like. Providers will have to start reporting data in July of 2018, and then the state agencies will make data available beginning in 2020. And they'll specify what that data really is, but we know it will include things like the number of transitions, like Allie was talking about, the number of transitions out of programs, the resources engaged, and other relevant information, possibly demographic data on the children who are transitioned out of programs, to really help us as advocates get an idea of where transitions are occurring and what resources are able to be utilized and which ones, where people are having issues accessing resources, so that we as advocates can go out and advocate for additional resources. The ALANCE and Illinois Action for Children and other advocacy organizations are continuing to spread the word about the legislation. At conferences and other big events, we're continuing to present on this to make sure that everyone has the correct information. We're happy to continue answering questions that anyone has to make sure that this is implemented in the correct way, and that providers have opportunities to connect with resources. And other organizations, like some of those training and technical assistance agencies, they're beginning to identify additional ways to support providers to make sure that the trainings that they're making available are there to support providers and prevent expulsions, and we'll continue to work with them as well. So now we're going to move into the questions, and like I said, we're going to first answer some of the questions that we got ahead of time. And I will read off the questions, and then I'll see if Allie or Jonathan or myself who will answer them. So the first question we got is, what about safety of staff or other children? Jonathan, do you want to go ahead and take this one?
Yeah, so this was actually a part of the bill that we worked on with the State Board of Education's legislative staff way back when. But there's a piece of the law that says that if there's any if the student or the student's peers are in any imminent danger, the child or the staff, that's right, or the staff are in any imminent danger, they can be temporarily removed from the educational environment. And that's to make sure that everybody is safe and happy in their early childhood setting. We do want to make clear that the kids should be returned to their classroom as quickly as possible, but we want to make sure that everybody feels comfortable in their classrooms day to day.
And also that in that instance, it should also trigger kind of the same process of utilizing your community resources in the short term, communicating with the family, and documenting all the steps that you're taking.
Thanks, Ellen.
All right, so what will enforcement of this bill look like? I'll go ahead and take that one. So like I just was talking about, that's really for the state agencies to decide how they will be monitoring this process. And they're working on that right now, and like both of through ISB and through DCFS, those will both go through public comment periods, so you are welcome to comment once they come out with their implementation plan, but that is really in the hands of the state agencies now. And the next question is, what about a probationary period for new children and families? So I believe this is referring to a lot of programs have a probationary period right when the child enrolls. So is this different when a child is first enrolled? Are you allowed to, if they have challenging behavior, are you allowed to expel them at that point, or what does that process look like? I don't know that we specifically talked about this in developing the legislation. I'm guessing that it's the state agencies will say that it's the same as what we've outlined in this legislation, but Jonathan or Allie, do you want to take a crack at that?
Yeah, so I think the legislation, it doesn't go into that much detail about specifying if a program can or cannot have a transitionary period. I know a lot of programs do. I think the guidance would go kind of the same way, where you know, you see if the program and the family are a good fit, but you know, if there are challenging behaviors, then again, you just would document everything, all of your interventions, continue to talk to the family, and then if it's not a good fit, have a transition plan. So I think it's probably kind of the same, will be the same guidance and best practice.
Mm-hmm. Okay, so what if there is not a place to transition a child to? Jonathan, do you want to take that one?
Yeah, sure, I can start. So this was actually, all of these questions are jogging my memory as to how some of this language got into the bill in the first place. But I remember long ago sitting down with some of the folks who represent large school districts, and they wanted to, I mean, it's also feedback we've gotten from our own provider community, but there are places, especially outside of Chicago and the suburbs, where there aren't a lot of other early childhood programs around. And so, or the other resources, interventions that should be around might not be easily accessible by the family. And so we made sure to put into the law that, you know, providers should utilize a range of community resources if available and deemed necessary. I think we want to make sure that we're not penalizing providers if there aren't resources readily available to them and to the families that they serve. We also note in the plan transition section of the law that it says if there's documented evidence that all available interventions and supports recommended by a qualified professional are exhausted. And so there, again, we're not trying to give out clauses, but I think recognizing that the amount of resources available to providers varies depending on where they're located and what kind of services that program offers, and we want to make sure that this isn't a punitive measure. We want the families to be supported, the children to be supported, and the providers to note that. But we also do, as part of our data documentation, want to make sure that people are, we keep repeating, documenting all attempts to access some of these resources and other programs, just to make sure that, you know, that's a good data point for us policymakers to know where resources are not available to those who are seeking them.
Yeah, so this will actually help us establish a baseline as a state for kind of looking at where our resources are available and what types of resources are available. So the data collection piece is really important because that will help us show a need of where things need to improve and where we can further advocate for resources.
I know that data collection is sometimes somewhat onerous on providers. You all have a lot to do and not a lot of time to do it. And so, you know, we worked with DCFS and ISB to make sure that the data reporting wasn't overly onerous, but and we also want you all to know that we're going to use that data to try to improve the policy, but also improve our programs. And so even if it feels burdensome at the time, hopefully know that it's going to good use, or hopefully will go to good use in the future.
Yeah, and we and the state agencies are always, as Jonathan said, looking at ways where you're already collecting a lot of this data and information, and how to just further use that in the context of expulsion, so that we're not overburdening either the programs or the state agencies in additional data collection.
That's right. And just one more thing on the transition piece, I do want to clarify that we were sure in this legislation to make sure that we didn't specify that a child had to be transitioned to another early childhood program. You know, providers should make all attempts to make referrals to other programs in the community, but sometimes home is the best place for a child at a certain time, or with other family members. So there's no specific place that, you know, the child needs to transition to, but as long as you're working with the family and providing referrals where appropriate, that's really what that's getting at. So the next question is, will there be more funding for consultation to help providers? I'll go ahead and take that one. There is not more funding built into this legislation. The intent is really to make sure that providers know that's even an existing resource. A lot of providers don't know about that. So it's really to make sure that we are taking advantage of those existing resources, but then also, like Jonathan and Allie were just saying, we want to collect data on when providers attempt to utilize consultation services and other resources, and show that, you know, what kind of need there is, and if that can kind of arm us to go back and ask for more funding for those services.
And can I just jump in here, Maria, for one thing too, is that, you know, we as the early childhood advocacy community here in Illinois work on substantive legislation like House Bill 2663, but a lot of the work that we do in Springfield is budgetary in nature, and we're constantly asking the legislature to appropriate more money for early childhood programs, both at ISB and DHS. And I think we saw this bill as the first step in a long-term plan to try to solve this problem of early childhood expulsions, and wanted to create a policy first, and then over time we'll hopefully be able to advocate for more resources for early infant childhood mental health consultation, or you know, any of the other best practice supports that Allie noted in her slides.
And to offer kind of a sense of hope, there really is a groundswell of support and engagement in the mental health community right now in Illinois around infant and early childhood mental health. And there are statewide initiatives that are happening to expand consultation, develop a model, and kind of prioritize programs, knowledge, and understanding and use of mental health consultation. So the passage of this expulsion legislation is really step one. We don't foresee ourselves stopping there. This is a setting in motion a long process of, you know, what needs to come next, X, Y, and Z.
Mm-hmm. So building off this, another question we got is, you know, sometimes we have to wait weeks to get an appointment with a consultant. What do we do then?
And so I think, again, what we've said is to just make sure you're documenting that. Again, it comes down, there's enough flexibility within the legislation that if it's a serious safety concern, it's still within the purview of the program to keep the program safe, the kids safe, the staff safe, and transition a child out if it's not a good fit. It's just making sure that the family is still involved in that whole process and decision making, and that you have utilized or tried to utilize as many resources as are available. If they're not available, then again, document that.
And I think one thing to note here, which is I keep saying, or find myself saying a lot these days, is, you know, the plan is for if you're receiving funds from the State Board of Education under the Early Childhood Block Grant, the plan is to recompete the entire block grant in FY19. And because we've actually gotten increased appropriations over the last number of years, we're encouraging providers to put into their grant applications funding for mental health consultation and these types of services that are going to support staff. You know, as budget cuts or level funding had been in effect for 8 or 9 years, I know that those are some of the first things that come out of ISB grants, because we want to make sure that the most number of kids are actually in seats. And so, encouraging and imploring providers to think about these sorts of supports and building them into their grants is really important.
Definitely. So teachers are not trained to work with children with atypical aggressive behaviors. Will there be training?
And so the legislation does ask the state agencies to make available the trainings around the topics that we put into the legislation. And so again, part of the drafting of this legislation was working with the state agencies and seeing kind of what they currently have available, and so that they can know which ones would apply to addressing the expulsion issue. And then I think that's also part of so using what they already have, and then that's part of the conversation moving forward is again, it's up to the state agencies, but hopefully as this rulemaking process is moving forward, kind of taking a look at what areas might be lacking, and if there is ability within the state agencies to do additional training or create new trainings, that would be great. But then this is kind of where the advocacy community will kind of help supplement that. If there is not ability within the state agencies, then how can we connect other opportunities and trainings and make that information available to the programs and providers and partnering with the state agencies. And so I'll give you kind of a specific example in some of the work that I do with the Illinois Childhood Trauma Coalition. If there are not trainings on trauma within DCFS or ISB or Gateways, how can the Trauma Coalition and all of their member organizations support trauma training for early childhood providers? So that's just a specific example of work moving forward and discussions that still need to happen. But that's why on that last slide we were talking about, trying to really build those statewide partnerships so that we can further help support providers and the state agencies.
Definitely. So I want to be mindful of everyone's time, so I'm going to ask one more question, and then I know we got lots of questions that came in during the webinar. So like I said earlier, we will take those questions and we will type up the answers to them, and we will send that document out to everyone who registered for the webinar. So I know we didn't get to everyone's questions, but we will get them answered. So the last question I will ask is, what is the role of the parent in this process? And maybe Allie, do you want to take that one? Sorry, I know you've talked a lot.
So I know this question probably comes up because I've heard programs say, I'm doing everything I can, but that parent just won't comply, or they refuse, or we've had some concerns recently too in the Hispanic community of perhaps families being fearful of additional services. And so again, we're acknowledging that there are going to be plenty of instances where you can't engage a family for whatever reason. And so again, documenting that. The legislation does not require anything of parents. We couldn't write into the legislation that, parents do X, Y, and Z, that they do this many interventions or that. But the legislation does put in the best practices of that family engagement piece, and just making sure that you are engaging the family in all conversations from the beginning, any intervention plans, any decisions, any transitions, and then documenting that, and then in the absence or the refusal of the parent, that you're also documenting that. So the short answer is that the legislation does not specifically outline anything or legally require the parents to do anything, but the family engagement piece is a big part of it, but still leaving the flexibility open for the program if the parent refuses or can't engage.
All right, thanks, Allie. So that we're out of time with that, but a couple announcements before we end. First of all, I want to thank everyone for joining us. This was a great turnout, and we hope that you guys felt like it was good information. We will be making the PowerPoint available to everyone who registered for the webinar, so look out for that. And just a quick plug, I know Allie and some of our folks here at Illinois Action for Children are doing a webinar next Tuesday on infant mental health. So it's really tied into this issue. It's next Tuesday from 12 to 1, and you can find more information at partnerplanact.org. And just look out for an additional email with the PowerPoint, as well as answers to additional questions. thank you all for joining, and thank you, Jonathan and Allie, for doing this as well.
Thanks, guys.
Thanks, Maria. Thanks, everybody.
Thank you.